Hello, I'm Dr. David Krakowski, and we're here today at Chatham Animal Hospital with Ollie to demonstrate a little bit about dental care. Dental care is an extremely important aspect of taking care of our pets because tooth loss is a common thing. Our pets live much older than they have in the past, and their teeth really need to have some care in order to allow them to be present for their entire life. A dog like Ollie could easily live to 15 to 17 years of age, and his teeth won't last that long unless they're cared for properly. So as far as what you could do at home, the initial process is to teach your dog to allow manipulation of their gums. Just to pet their gums, open their mouths, make this no big deal for him. Once that's completed, and he accepts that pretty well, you can take an oral dentifrice. The one I like to use is Oratine. It's actually a cousin to Biotine that many people use. Get it out of the package here. And initially when I start the training, I just put some on my finger like so. Next thing, after you've placed some on your finger, is to just get them used to you rubbing it on the teeth and the gums, like so. And initially you're just going to do this, and then you go away, tell them they're good boys, let them run off and play, and you're done. The important thing is to do it daily if at all possible. I know that's very difficult. We're all very busy and hard to find time to do it, but we sort of intuitively obvious that we're not going to be able to keep their teeth in good shape by doing it once a week or once a month. Recently there's actually been a study showing that it doesn't really help much to do it if you don't do it at least once every other day, daily being best. So if you can all work it into your schedule, and nighttime when you're brushing your teeth is not a bad time to do it, make it a family affair, it would be very helpful to them. So once you get to the point where they're allowing you to do your finger with no problem, then the next step I usually do is to use a gauze sponge, such as this. So I take the gauze and wrap it on my finger like that, and I put the paste on the sponge, and then I use the sponge as a slight abrasive to help to remove the plaque from the teeth. And the plaque is what turns into the tartar. Got them used to using your finger. The next step is to add a gauze sponge. And if you take the gauze sponge and wrap it on your finger like this, you can use it to go up inside these cheek pouches here and remove food. And that's important because when a dog eats, if you look inside their mouths, back in these, by these chewing teeth where the cheek pouch is, there's food collected up in there, and that just acts as a substrate for bacterial growth. You're using your finger wrapped in the gauze sponge to just remove any debris that's back in the mouth. You just do that quickly, it just takes a second. And once he's used to having that done, then the next step is to add the dentifrice. I like the Oratine product because it's tasteless and it's got enzymes in it that help to kill bacteria, or inhibit them, I should say. It's flavorless, so they don't try to eat it and they don't mind it. So you put the gel on your gauze sponge, and you get back up in there and clean those teeth and spread the spread the gel on the teeth. You see that his back teeth turn around and go back on a bit of an angle towards the back of the skull. And that's the place where tartar starts to form. You can see in Ollie here that already, though he's recently had his teeth cleaned, tartar starting to build, and he has some inflammation of his gum line. If all that goes well, you can proceed on to a toothbrush. This particular brush I like because it has this sort of flexible end on it. And when you, Ollie, sit, buddy. When you use it in the back, it sort of bends around into the mouth. So you can load your brush. And lift these lips and go in the mouth. And you see I'm getting way in the back here. Now, even doing this, you can't possibly do as good of a job on their teeth as you do on your own. And we, as people, go to the dentist generally about every 6 months and have our teeth cleaned. With our pets, usually a yearly cleaning is a pretty good way to go. See the brush going up underneath the gum line there? And if you see a little blood, don't be too alarmed by that. That's because the gums are a little bit inflamed because of the tartar. I'm Dr. David Krakowski. This is another edition of Pet Topics from Chatham Animal Hospital in Cary, North Carolina. Thanks for watching.